An ovarian follicle is a structure found within the ovaries, and it consists of an immature egg, which we call an oocyte, surrounded by supporting cells. These supporting cells are, they're just as important for the growth of the ovum as the ovum itself. An oocyte is what you might call an egg cell, and that's not a great word to use because egg could refer to a fertilized or an unfertilized egg. We use the term ovum, the plural of which is ova, for an unfertilized egg, and we use the term zygote for a fertilized egg. Ova go through cellular divisions of meiosis in a process called oogenesis. At the same time, there are cells surrounding the ovum called granulosa that also grow. Together, the granulosa cells and the ovum, they form an ovarian follicle. These follicles grow along with the stages of oogenesis. The growth of a follicle, any follicle, not just ovarian, is called folliculogenesis. At any given time in an ovary, you can find follicles at all different stages of development as shown here. The female has two lumpy, oval-shaped structures called ovaries, each measuring about 5 centimeters, which I guess is about 2 inches in length. The surface of the ovary is covered by a simple cuboidal epithelial layer that's called the germinal epithelium. Blood is brought to the ovary by an ovarian artery, and it's drained by an ovarian vein, both of which are in the medulla or the center of the ovary. Production of gametes occurs in the cortex of the ovary around the outside. Ideally, the ovaries in a sexually mature female alternate to produce one ovum or egg each month. The specific process for developing an ovum is called oogenesis, but it's not that simple as just growing an egg. This is part of the ovarian cycle, which refers to all of the processes that occur in the ovary during a monthly event, not in the uterus. Uterine cycle and ovarian cycles are connected, however, they are two separate things. One being events in the ovary and one being events in the uterus. Primordial follicles are the most numerous and earliest stage of follicular development in an ovary, and they make up the majority of oocytes in an ovary. Each primordial follicle contains a primary oocyte arrested in meiosis I, which is a state in which it can remain for years, even decades, even half centuries. The oocyte is surrounded by a single layer of simple squamous granulosa cells. And these cells provide minimal support and protection in this dormant stage. These follicles are located in the outer cortex of the ovary, and they're not hormonally active, meaning that they're not producing hormones. Each month, in response to very subtle signals, a small group of these primordial follicles are activated or recruited or awakened to enter a growth phase. This recruitment is independent of gonadotropins, and it's driven by local paracrine growth factors. So it doesn't depend on FSH and LH from the anterior pituitary at first. At first, it just depends on local growth factors. Once these oocytes are recruited, the granulosa cells around them become cuboidal, and the follicle transitions into being a primary follicle. This monthly activation ensures that the ovary maintains a steady supply of developing follicles throughout the lifespan. A primary follicle forms when a primordial follicle is recruited into the growth phase during that early part of the ovarian cycle. A primary follicle contains an oocyte that's been recruited from the resting pool, and this oocyte remains a primary oocyte arrested in meiosis 1. The hallmark of a primary follicle is the transformation of its surrounding follicular cells from those flat squamous cells in a primordial follicle into a single layer of cuboidal granulosa, and these begin to support the oocyte's growth. The zona pellucida is a protective glycoprotein coat that is around the oocyte and also begins to form at this stage. And I'm just going to highlight this on the second oocyte, the zona pellucidum, because it's not readily seen on the primary oocyte. At the primary follicle stage, the follicle, it's just responding to local growth factors produced within the ovary rather than responding to gonadotropins like FSH. These local paracrines, they stimulate that granulosa cell proliferation and the oocyte development. The primary follicle represents a really important transition from a dormant to an actively growing follicle. And this lays the groundwork for like more advanced stages of development and ultimately ovulation. A secondary follicle develops from a primary follicle during the follicular phase of the ovarian cycle. And these follicles are found again in the cortex of the ovary. At this stage, the follicle still contains a primary oocyte arrested in meiosis. As the follicle matures, it develops 2 or more layers of granulosa cells, and they also proliferate and begin producing really small amounts of this follicular fluid, which is going to build up in our follicle. These granulosa cells, they also begin to express FSH receptors. And this allows the follicle to now respond to hormonal signals from FSH in the anterior pituitary gland that continue the growth of the follicle and estrogen production. Outside the granulosa layers, the follicle becomes surrounded by the developing fecal cells, and they organize themselves into 2 layers, the theca interna and the theca externa. The theca interna is hormonally active, and it produces androgens that granulosa cells convert into estrogens, not just estrogen, but estrogens, like estradiol. This coordinated development between the granulosa cells and the thecal cells, and this is happening under hormonal control, it ensures that this oocyte is ready to be released if fertilization is possible or an ovulatory event happens. A tertiary ovarian follicle is also known as a Graafian or a mature follicle. And it's the very final stage of follicular development before ovulation or before the ovary spits forth an ovum. The follicle houses an oocyte, and this oocyte has completed the first round of meiosis, and now it's arrested in meiosis 2. It's like it can never complete its cell division. There's a small cluster of granulosa cells around the oocyte called the cumulus umbris, and this anchors the oocyte to the inner wall of the follicle. Surrounding the oocyte is a really thick glycoprotein coat called the zona pellucida, and it plays a really important role in sperm being able to bind to the ovum during fertilization. Immediately outside the zona pellucida is one single layer of these granulosa cells, and this single layer is known as the corona radiata. And this corona radiata, it remains attached to the oocyte at ovulation. And you can see it on this ovulated ovum over here. The antrum, which is a fluid-filled cavity, it develops and it expands a lot in a tertiary follicle. And it pushes the oocyte and the surrounding cells to one side of the follicle, kind of getting ready to burst it forth. This fluid, it's just called follicular fluid. It contains hormones and growth factors, and it's there to nourish the granulosa and the oocyte. After ovulation, the ruptured tertiary follicle that remains in the ovary, it transforms into a temporary endocrine structure called the corpus luteum. This yellowish body, which is what corpus luteum means, it forms from the remaining granulosa and thecal cells, which luteinize and begin secreting large amounts of progesterone and a little bit of estrogen. Progesterone plays a really important role in developing the uterine lining or the endometrium. It makes it thick and vascular in preparation for a possible pregnancy, right? Your ovary, somebody's ovary has just spit forth an ovum, hoping it'll be fertilized. So, yeah, we might as well make the uterus ready. If fertilization does occur, the embryo releases human chorionic gonadotropin, HCG, and it signals the corpus luteum to persist and to continue with hormone production, mainly of progesterone. And this is what supports early stages of pregnancy until the placenta starts to take over. If pregnancy does not occur, the corpus luteum degenerates after about 10 to 14 days, the time during which it emits progesterone. And when it degrades, it becomes a structure called the corpus albicans, which is a small white fibrous scar tissue that will remain in the ovary forever. The drop in progesterone, because that corpus luteum was making the progesterone, the drop in the progesterone level leads to the breakdown and the shedding of the uterine lining during menstruation. Each ovary contains follicles at all of these various stages of development, as well as the past remnants, like the corpus albicans, which accumulate over a woman's reproductive years. PCOS, or polycystic ovarian syndrome, it's a hormonal disorder, and it causes enlarged ovaries with multiple cysts in them, often leading to very irregular menstrual cycles, sometimes infertility, maybe acne, excess hair growth. It is associated with insulin resistance and also an increased risk of type 2 diabetes and cardiovascular diseases. So it's not just about fertility. Ovarian cysts are just fluid-filled sacs that develop on or inside an ovary, often forming during ovulation, and they usually resolve on their own. Some cysts can cause a lot of pelvic pain. They can cause bloating, and they can cause complications when they rupture, or even cause ovarian torsion, which is twisting, if they become really large. Ovarian cancer arises from the cells of the ovary, and it's often detected very late due to vague early symptoms like bloating and pelvic discomfort. It is one of the most lethal gynecological cancers due to its tendency to spread massively beyond the reproductive organs before it's noted. HPV, or human papillomavirus, is a common sexually transmitted infection that can cause genital warts and is the leading cause of cervical cancer. Most infections clear on their own, but persistent high-risk strains of HPV, they can lead to cancerous changes in cervical cells over your lifetime. An omphectomy is the surgical removal of one or both ovaries, often performed to treat ovarian cancer, cysts, or to reduce the risk of cancer in high-risk individuals. Removing the ovaries can induce early menopause, it can affect hormone levels, certainly affects fertility, and it can affect overall cardiovascular health.